you, Emily. Appreciate that intro. I first came across our speaker tonight when I was listening to an American Nurses Association See You Now podcast that was called Planetary Health Healers. So the other speaker on the podcast was Katie Huffling, who happens to be the executive director of Alliance of Nurses for Healthy, I always get this one wrong. Alliance of Nurses for Healthy Environment. That's it. Anyway, I struggle with that name for some reason. It's a mental block. So I reached out to Katie and said, do you have any way to get in touch with Kasey Bellegarde? I think she'd make a fabulous speaker for our New Hampshire healthcare workers for climate action. So she was gracious enough to give me Kasey's contact information. Kasey is an RN and a master's in public health nursing. She's a design specialist with the innovation platform for Ariadne Labs, where she works to address healthcare's grand challenges with effective solutions that meet people's needs and improve their lives. When she's not in her day job, Kasey is a doctoral student in nursing practice in health innovation and leadership with the University of Minnesota School of Nursing, focusing her studies on how we can shift healthcare and other systems towards healthier relationships with the planet. Yay. She has been involved in local, national, and international climate action and advocacy efforts, including attending the annual UN Climate Summit, COP27, as a delegate and producing a guide inviting nurses to help get carbon out of healthcare. I don't know how many of you know about the DHHS health system sustainability program, which we've been actively working on here in New Hampshire, and with not much success yet, but we're still pushing it. So this would be coming very handy for our nurses to advocate in addition to our physicians. She holds leadership positions as a member of the American Nurses Association Innovations Advisory Committee on Planetary and Global Health, as well as a governing counselor with the American Public Health Association Public Health Nursing Section. Kasey lives in Massachusetts, right next door with her family. Hopefully someday we'll successfully convincing them to live on a farm, maybe here in New Hampshire. Thank you very much, Kasey. Take over.
Thank you, Joan, and thank you, Emily. It's great to be here with you all. And any tips on convincing my family to live on a farm, I'll appreciate it. And you can drop them in the chat. I'm excited to spend the next hour with you. I'm just going to pull up my slides and then we'll get started. Let's see here. Just going to make sure we can get. Okay. All right, can you see my screen here? Beautiful. Just the slides, not the notes? Fabulous. We're in business, folks. Okay. Yeah, thanks again for being here with me. My plan for our time is to talk through a couple of case studies on how I've kind of tested and learned my way in climate advocacy as a nurse. These case studies / stories will illustrate some examples of how health professionals can get involved in climate advocacy at different levels. I definitely encourage questions and comments in the chat. I find climate advocacy raises more questions for me than answers, so hoping we can learn together throughout our time. I am also going to highlight, after our case studies, the UN Framework Convention on Climate Change, the COP process, which Joan alluded to. It's a really key opportunity for health professionals to engage with climate advocacy, especially with COP28 coming up around the corner in a few short months. And then to close, I'll share a little bit about some work I'm digging into on health diplomacy and how it can serve health professionals and their advocacy for climate action and planetary health and human rights, both in spaces like the UN and then here in our local communities. And then I'm hoping we can have some Q&A and chat a little bit. Does that sound good? All right. So first, Joan gave me a beautiful introduction. I'm just going to share a little bit more about where I'm coming from and what guides me. I'm based in Massachusetts on the ancestral and unceded lands of the Massachusetts Wampanoag and Pokanoket peoples. In my professional life, I wear a nurse hat, I wear a healthcare design hat, and a planetary health hat. And there on the left is a little bit of my home life with my sweet dog and my husband. It's important to me too to say that, I situate my climate advocacy as part of a larger practice as a planetary health nurse. If you aren't familiar with the term, planetary health refers to the health of human civilization and the natural systems on which it depends. And the figure pictured here is the planetary health education framework, which was developed by a group of experts at the Planetary Health Alliance. It's essentially looking to capture what are those essential knowledge, values, practices of planetary health across these 5 domains. And in my nursing career, I found the field and movement of planetary health as a really important place to go to understand where climate change fits within a bigger picture of human disruption to Earth's natural systems. So thinking of climate change as just one symptom of a planet in multi-system failure, together with other symptoms like biodiversity loss and pollution. And thinking about that helps me be a better climate advocate, because then I can see how interventions can then work together to treat multiple planetary illnesses that we're seeing. What I appreciate the most about planetary health is this central domain, the interconnection within nature. That has really been key for me to understand things like climate action and ecosystem restoration and species conservation as human health interventions too. And so I have that lens as I'm talking with you all, that, my caring science as a nurse, I apply it to the land as much as I do the people that I've cared for. Think practicing things like empathy, curiosity, wonder about the life around me. It makes me a better nurse of both people and the planet. So in that spirit, I just want to start us off by sharing a little bit of love for the land here in New England and in New Hampshire specifically. The land here is where I learned how to love nature. I grew up here, and I feel really protective of the ecosystems in this region. And so it's really out of all of that my climate advocacy and my planetary health advocacy flows. Because while I grew up in Massachusetts, I spent my early years as a child living in New Hampshire, and it's a place that just has a lot of positive memories for my family and I. Things like late fall up in the White Mountains, and there's a bite of winter cold in the air, or summertime at Lake Winnipesaukee, hearing the loons call out over the water. It's really a really special state. And so those things help my climate advocacy really feel like it comes to life. And I invite anyone who's interested to share their own kind of sensory memory of nature that triggers a positive feeling for you. It doesn't have to be New Hampshire specific, but it could be if you wanted. I think we have so much empathy and care as health professionals, and that it's not new work for us to extend the healing that we know how to do so well, extend that to the planet. We're really just deepening our skills and competencies as healers and better understanding what it takes to promote health and to treat disease. And the more I think we can really practice and celebrate the bonds that we have within nature, I think the more we better the odds of transforming our ways of living and working and healing towards better health for all life on Earth. And I see some messages coming into the chat, so I appreciate you guys sharing those. It's good to remind ourselves of what we're fighting for and what's important to us, because as we all know, we're enduring the impacts of climate breakdown right now in the present. These are all headlines just from this month in the US and Canada. I'm sure we've all heard about the devastating wildfires in Maui and in Canada. tornadoes touched down in Massachusetts and Rhode Island last week. A historic tropical storm made landfall in Mexico and Southern California. Just living in a time of massive disruptions to the environment and to our health. And I know as health professionals, many of us feel a sense of real urgency and want to know the paths forward to take meaningful action on climate change. What are those levers we can pull to make a difference for our patients and communities? So I'm hoping we can talk through some of those levers together tonight. This is our first case study looking at birthing parents and children. I'm going to skip the polling question. This case study comes from the beginning of my climate advocacy journey as a nurse. I worked for a local health department administering the Nurse Family Partnership Program. And for those of you who don't know it, the Nurse Family Partnership Program is this amazing national nurse-led evidence-based public health home visitation program where public health nurses are paired with first-time low-income birthing parents, and they visit them throughout pregnancy and until their child's second birthday. And the program's been shown to improve pregnancy, early childhood, life course trajectory outcomes. Nurses collect data across different metrics like preterm birth and low birth weight to observe the effectiveness of the NFP intervention for this population. And so one day after completing my home visits, I came across this opening line from the 2019 report, the Lancet Countdown on Climate Change and Health. It was really a moment that just stopped me in my tracks. Reading it, I was like, does everybody know about this? Has everybody heard that this is happening? And, what are we doing about this? I just really couldn't get it out of my mind. And then suddenly I was just seeing this everywhere, all of this research emerging on how climate impacts like air pollution and extreme heat were associated with poor birth outcomes, like preterm birth, like low birth weight, those very same metrics that we were trying to improve with families served by our program. And so then in the Western United States, where I was living at the time, we were having a record-breaking fire season. So I'm reading about these disproportionate climate impacts on pregnant people and children, and then looking out the window at the air thick with wildfire smoke, worrying about my pregnant moms walking to the bus or playing outside with their babies and having to breathe in this polluted air. And so here was climate change as this opposing force disrupting these nursing interventions and throwing off our data, and really affecting the health of the families that we were partnering with. And we weren't even looking at it. The impacts of climate change on health and the opportunity for health professionals to get involved became really clear in that moment in a very local, place-based way. We're seeing climate change here right now. It impacts our family's health, and it's health we're trying to protect through our nursing interventions. And if we can get involved in climate action, then we can make a space for our nursing interventions to be more effective, for our families to achieve the health that they deserve. That was really a light bulb moment. So after doing some listening and learning on the science of climate impacts on maternal child health, I started looking for partners. So went to find some friends. I created a small but mighty community of practice with nurse home visitors from local agencies across the state who were passionate about climate change and environmental health. And from there, we were really able to strategize and coordinate actions to identify where we could spark change in our local agencies, as well as across our national program. And so for our first deliverable, we landed on a resource for nurses to talk with their families about climate and health. Our program had, as so many do, many resources talking to parents about pregnancy warning signs, about safe sleep, avoiding risks to their child's health, but we didn't have anything about climate change and health. And so we made one and we submitted it for approval to the national program's education team. And while that was in the works, we also requested a section of our program's national newsletter to share info out on climate and maternal child health and invite others, hopefully spark interest in other nurses to join us in this work, and really try to diffuse it across all of our programming. And then following from that, we had the opportunity to speak to our national programs legislative team. They had a group who worked on funding and policy for the program to really make the case with them to see that climate policy is maternal child health policy. And so in terms of learning from this experience, it highlighted really two big takeaways. Staying tapped into people's needs, experiences, their solutions really helps to co-design better, more equitable, more effective climate interventions. Also making an effort to find allies and collaborators to build your network really helps to spread your advocacy impact. And in terms of strengths and challenges, it was really a wonderful crash course in the power of nursing innovation to recognize and drive climate solutions based on a real identified need for our patients. And while most of us were super new to climate advocacy, we didn't need to have a degree in the field to understand the science, its relationship to health, and then take some action steps to better support our families. And then I'll say along those lines that because we were so close to the people we were designing for, we had really strong relationships with our families. We were able to test our education resource and practice with families. You know, if we talk about climate change in this way with you, does it resonate? What matters to you as a parent about this risk? And then to be able to make informed decisions about how to mitigate that risk. We were able to test that with them in real time to make sure it was as responsive to like what felt relevant to them and what messages resonated with them as much as possible. And then ultimately the education resource we created was adopted by the national program as a tool for nurses to access and start talking to families about climate and health, just like they would any other pregnancy or child health related education resource, which was pretty exciting. And it was definitely a lesson in how starting local can help open doors to national climate advocacy opportunities as we kind of started in our local agencies, and then we're able to tap into our greater national program. In terms of challenges, there were definitely some. We realized pretty soon that what we were doing was primarily climate adaptation, not mitigation. So we were doing, which was important, we were doing work to support our families to adapt to climate impacts already happening on the ground in our communities. And then we also know that mitigation, stopping the runaway train of climate change, is really that's the thing, that's the bar to prevent this disruption of health for our families. I'll also just name too that in terms of another challenge, we had served a program with families who had many different competing priorities, both like at the family level and also at the program level. There's significant inequities in maternal child health and structural barriers and struggles. And so trying to make climate change feel as relevant as possible is definitely a struggle and a learning that we took forward. And then case study number 2. So we talked about this was adaptation, not mitigation. So I'm going to talk a little bit about decarbonization and how that work evolved from there. So as I grew in my climate work, learned more about climate mitigation, I realized there were so many opportunities for nurses and other health professionals to really address the greenhouse gas emissions coming out of our workplaces and polluting our communities. This is in the context of, as Joan alluded to, some great momentum right now from leaders like the Department of Health and Human Services and the Joint Commission, who are calling on health systems in the US to do their part to avert catastrophic climate warming, we have to cut our greenhouse gas emissions in half by 2030 and reach net zero by 2050. Health systems are part of that carbon footprint, and so we have to do our part to cut our own emissions for the health of our communities. And so through my doctoral work, I had the opportunity to collaborate with a senior scientist at Project Drawdown, who is a big leader in climate solutions and climate science. We were able to identify and lift up effective climate mitigation solutions for our largest workforce in the health sector, which is nurses. We saw that if nurses could mobilize on this, we could make huge strides in getting carbon out of healthcare. It really can't move forward without us. And so Dr. West, the scientist that I worked with at Project Drawdown, guided me in framing solutions for nurses that were known to be effective, close to nursing influence, and readily available to put into practice now. That was really the guiding framework that he suggested we use to identify which solutions should be call out for nurses to be aware of. That was really useful in terms of designing a climate advocacy intervention, because rather than pointing nurses towards tech or other practices that hadn't been developed yet, or actions that they didn't really have any influence on, or roles that they, actions that their roles didn't touch, we could highlight those impactful solutions that were within nursing's reach right now. And so out of this collaboration came this climate action guide for nurses, which is featured here. And it was created as a reference for nurses to get started with health sector decarbonization. That's such a big topic. It's such a big task. So it's intended to give nurses a starting point to say, where could I start to make a difference in this work, where I live and at my workplace. And so the guide highlights key action areas of energy, transportation, food, supplies and devices, and medications as big sources of greenhouse gas emissions in the health sector. So for the purpose of our conversation, I'm just going to focus in on one action area of food and how we framed the advocacy opportunities for nurses in the guide. The ways that we grow, transport, consume, dispose of our food are all significant contributors to greenhouse gas emissions, and hospitals and health systems are no exception. So we chose to structure the guide by distilling the key levers for nursing influence. We talked about levers earlier, that as health professionals are wondering often how to get started in this work, it's like, what are those impactful levers for them to pull that they have influence over and that can make a difference? So we tried to distill down what those levers were for each of these action areas. And for food, we framed it as this, that nurses can advocate for local, plant-rich, sustainably grown food in their local communities, and to source their workplaces, as well as play a role in reducing food waste. And so the guide, each action area is designed to mirror a nursing care plan, that each action area has a diagnosis for each of the particular sources of greenhouse gas emissions in the healthcare system, and then health benefits associated with taking action in these areas, as well as interventions to address the source of emissions. And so we're looking here at the kind of diagnosis for the food source of greenhouse gas emissions in the health sector. And then this shows the intervention section and the health benefits. The interventions offer ideas for what nurses can get started with to reduce and chip away at greenhouse gas emissions from food. There are kind of practice change actions that they could take, as well as advocacy actions. And then really important, again, the health benefits, highlighting for nurses and for health professionals what we stand to gain for our patients' health if we take action in these areas and trying to make that connection really clear. And then the last thing that the guide has across each action area is a spotlight panel highlighting different nursing specialties to really try to envision what this could look like in practice across all kinds of practice areas. And so for food, the spotlight is on school nurses, mental health nurses, public health nurses, not to say that these are the only specialties that could have impact on these areas, but just saying what might it look like if they did. And so these nursing specialties were lifted up because they often have strong relationships with different community partners. So it provides examples on how to leverage those partnerships to advocate for more climate smart food practices. And that's really the gist and the breakdown of each action area on the guide. So taking away from this advocacy experience, it really highlighted for me the gift that is cross-sectoral collaboration, being able to partner with a climate scientist like Paul West at Project Drawdown to really translate the latest science and climate solutions for nurses and then try to vision what that action could look like together was really meaningful and really innovative. Climate advocacy, as we all know, requires that we break down silos between our different work sectors as much as possible and meet with climate scientists and farmers and engineers and city planners to really see how we can kind of creatively co-design solutions to the climate crisis. And then I also saw the power in highlighting how our solutions are connected to health, which we mentioned earlier. So making that connection really clear, especially in a health professional space. What is stand to be gained from taking action on climate? How does this directly impact your work as a clinician and your patients' lives, and making that really clear? And so ultimately, this climate action guide resource was shared out across several national nursing organizations and schools of nursing, and it was picked up by several faculty to use in their classrooms. However, I just really couldn't get it into the hands of every nurse in the country. And, with a topic as complex as this, having more in-depth support and accompaniment than like this 5-page action guide is often going to be necessary for it to be picked up and really implemented well. I could also see how nurses were bumping up against the reality of policy and politics as they were looking through this guide and trying to see how they could put it into practice. That is a reality. That yes, there's things that we have influence over, and also those things are influenced by many different levels of decision making that we may not have access to. So really felt like decisions were being made on climate that directly and indirectly shaped the lives of the families that we were caring for and the environments that we were practicing in. And it was happening in rooms that health professionals, and especially nurses, were not in, right? At tables that we didn't sit at. And so those concerns prompted me to apply to my university's delegation to COP27 last year as the first nurse from my school to attend. And so I just want to touch briefly on COP because, as I mentioned, it's a really important opportunity for health professionals looking to really pull on that lever of global climate advocacy. So if folks aren't familiar, what is COP, right? Even if you've been there, you're still like, what is this? It's a complex process. So to boil it down, every year world governments meet to negotiate their coordinated response to climate change, and that happens at an event called Conference of the Parties, or COP. Parties is the word that the UN uses for countries. And so this process is overseen and facilitated by the United Nations Framework Convention on Climate Change, or the UNFCCC. And the UNFCCC's task is to hold world governments accountable to the terms set in the 2015 Paris Agreement, to keep global temperature rise to no more than 1.5 degrees Celsius. And the meeting's held in a different host city around the world each year. And in this past November in 2022, it was hosted in Sharm el Sheikh, Egypt, for the 27th running of the conference, hence why it's called COP27, and this year is COP28. And so in addition to heads of state and government officials and the business sector, members of civil society like climate activists and academics and NGOs are also able to attend to observe the negotiations. So in my time at COP, learned a ton about the inner workings of climate negotiations and policy at the global level that I definitely don't think I would have been able to experience anywhere else. Also observed how distant those negotiations felt from the families that I worked with in the Nurse Family Partnership Program days, who were walking to the bus in extreme heat or playing outside with their babies in the wildfire smoke, not knowing about the hazards. And so regardless, the consequences of what was happening in these negotiations was reaching my families, even if the conversations happening there seemed like they had nothing to do with what their lives actually looked like. They reach my families, and they'll reach our family, all of our families, all of our patients that we take care of. These negotiations really shape the environment that people raise their children, shape their opportunities for health and for disease. So the question that I was asking myself was, don't we as health professionals want and need to be a part of these policy discussions because of the impact that they have on our patients' health and our own practice environments? So I mentioned that coming up right around the corner is an opportunity to do just that, and to join in on the conversation. In November and December of this year, the United Arab Emirates is hosting COP28 in Dubai, with the first ever health day as part of the conference's main themes. And so this will include an official health program of events and the opportunity for health to be a significant focus at the negotiations where it hasn't been before. And that's really prompted many to refer to COP28 as the health COP. So now is the perfect time for health professionals who are interested in climate advocacy to start paying attention to the COP process and being a part of that conversation to drive the message of climate action as health interventions. Jenny Miller from the Global Climate and Health Alliance, pictured here, really said it best, that the health community can use our trusted voices to push for effective climate action that protects people's health. And we can do that by speaking to the media, by working to shape local and national policies, and by engaging to influence the COP negotiations and decisions. Being that voice for health is a really critical role for health professionals to play. And so you may be more interested in or comfortable with local policy, state, regional policy, or comfortable with no policy at all, which is definitely the boat that I've found myself in most of the time. But it's true that no matter where your preferred sphere of influence is, that it's no matter where you are, you're really deeply intertwined with global climate policy. We can have the greenest, cleanest local climate community policies, but if there's not large scale coordinated global climate policy and action, then it won't matter, right, how much action we take at the local level. All of those things have deep intertwined relationships, and what's decided up here, it all comes down to affect our patients and our health systems and our communities. So health professionals are also just truly starting to pay attention to COP and to global climate policy. And if you're one of these people, this slide highlights example roles that you might play as a health professional. So I'll just highlight them here. First one is staying informed. COP is an annual gathering, but it's also a year-long process of climate negotiations and decisions that lead up to that annual gathering at the end of the year. And so there's ample opportunity for health professionals to tune in and follow what's happening. I've highlighted a couple ways to do that. Earth Negotiations Bulletin is a really great newsletter to stay informed about UN climate updates and the biodiversity COP and just other kind of climate and environmental health related news. And the Global Climate and Health Alliance, who I mentioned, they're an organization who's really highly engaged with COP and in making sure that the health voice is represented there. So following their work is a good way to kind of stay tuned and know what's going on and keep a pulse on the negotiations. And then the second is to play a role in translating what's happening in the negotiations into health terms for your networks. So when the negotiations stall or when there's a policy win that happens, what does that mean for health? And being able to lay that out. That's something that we can talk with our patients about with in our workplaces and on any platforms that we have access to. And then the last thing is to engage, and that means somehow get involved to shape or influence COP negotiations and discussions. There's organizations that have observer status with COP, and so is there a way that you can support them in providing the health perspective for their work to support the work that they're doing? Or does your own organization or university have a path for you to go to COP and represent the voice of health and the voice of health professionals? This is really a space that has so many opportunities for health professionals. As climate advocates, we can play a big, important role here. I really see climate advocacy as something that can be bidirectional and local to global for health professionals. I attended COP because I wanted to understand the processes related to climate policy in order to translate that back to nurses, to patients, and maybe someday offer that return translation to policymakers. You know, if I can understand policy better, then maybe I can translate to say, this is what your policy means for people's health and how it impacts their lives on the ground. This is the human and the health implications at the center of your policy. And so that's why my current doctoral work is focused on how to bridge nurses and other health professionals into spaces like the UN. Pictured here is the General Assembly, this big, beautiful room, and wouldn't it be incredible if it was full of nurses? If nurses and other health professionals were here, we could better influence important issues like climate change and planetary health and human rights. There's a lot of data showing that our voices and expertise as nurses are underutilized in spaces like the UN, not just in global health, but in matters of peace and security and sustainable development. No matter what level of climate advocacy we're trying to impact, there's power that we have as health professionals in trying to transcend disparate, disconnected, opposing ideologies, values, geographies, bridging socio-political barriers, and we can do that through the message of health. I think educating ourselves on processes like COP and on systems like the UN allows health professionals to really step into this role of global citizen, of health diplomat, ambassador of caring. We can really play those roles to consult on policies that shape a healthier present and future for the planet. I put together some resources here for health professionals who are just looking to learn more about planetary health, climate action, or decarbonization. So hopefully we can share these out afterwards so folks can have access to these links. But this is a good place to start if you're looking to learn more information. And then I've also highlighted, these are some organizations that are leading at the intersection of health and the environment. Special plug for Nursing for Planetary Health, which is right there in the center. It's a movement launched by a nursing leader at my school of nursing, Dr. Teddy Potter, and her colleagues, really inviting nurses to the work of healing the planet. So these are great places to check out and places to start if you're looking to learn more or lift up their work. I'll close with this quote. This is one of my favorites from Arundhati Roy. I think it really perfectly summarizes the hope of climate advocacy. We as health professionals have this incredible opportunity to participate in the building of a new world, which sounds crazy, but it's what we're trying to do, right? There's huge transformations that need to happen in the ways that we live, in the ways that we work, empower our lives, and take care of each other. And so we can make this new world, right? Where all species have the right to grow and age in health and well-being. And we just have to each of us just have to find our right corner of the work to get started. So I'll stop there and would love to see if folks have questions or dig into anything. And thank you again so much for your time.
Thank you very much, Kasey. That was fabulous. I learned a lot of things. I'm wondering if anybody has questions. I'll start off because this is something that's near and dear to our organization's heart. Is, have you found any specific strategy or strategies to get a health system to seriously entertain working towards sustainability? And if so, what is that strategy?
Ooh, what a good question. I think that there's not necessarily one right answer. If I had to boil it down, I would say really trying to align and find out what are the priorities for that health system and how can you make the argument the sustainability aligns with their priorities, right? For some health systems, that's like we're focused on the bottom line and sustainability can save them a lot of money. And so like, how can you make that argument really clear? And for others, they have new initiatives on the horizon related to, I don't know, say population health. And so how can you make the argument that sustainability brings so many co-benefits for population health and that's aligned? It's not a whole new initiative, it's aligned with their current priorities. So those are some things I would say. I think, again, there's not one right magic bullet, but trying to align as much as possible with what their priorities are, and really frame your argument for sustainability that it aligns with those priorities.
So in the chat, Cynthia Nichols is asking, do you know of any platforms where people are sharing mitigation health system actions or projects? What works, what didn't?
Yes. So Practice Green Health and Healthcare Without Harm are two leading organizations in health sector sustainability and decarbonization. So definitely check out their websites because they have, especially Practice Green Health has case studies that are open access for other health systems. I would also call out the Healthcare Climate Council website. They have this like climate action playbook for hospitals and health systems. And they have also a lot of case studies on this health system tried this, they saved this amount of money, they reduced this amount of waste, to really just make those examples clear of like what's worked and what hasn't too, for other folks that want to get started in the work. So I would name those resources as helpful.
Thank you so much. What was the second one you mentioned after Practice Green Health? And before the Healthcare Climate Council?
Healthcare Without Harm.
Thank you.
Yes.
Great, thank you. Any other questions? If not, oh, Paul, you have your hand up.
Thanks, Joan. My question is sort of corollary of Joan's. I mean, I think it's great to get involved with COP 27, 28, what have you, but have a little jaundiced view about that type of things coming from a high policy stage, because it's one thing for a nation to develop a policy and say they're going to commit to it, but when the rubber hits the road, they're not going to follow through if it's not going to be politically or economically feasible. And so that's why I think our organization, New Hampshire Healthcare Workers for Climate Action, is so interested in grassroots and local. And to me, I don't want to see more proliferation of different silos of people working in different organizations. You showed all those emblems of all these great organizations that were working pretty much on the same thing, but a lot of, we got to get in one action. And I really see organizing nurses as so powerful, such a powerful potential. Nurses are the most important profession in healthcare. Numbers wise, work wise, and now that physicians are just employees of health systems like anybody else. I mean, we don't have any special power over anything anymore. We used to have a lot more. I'm a physician, but to organize nurses, especially there are nurses unions in some part of the country, I think. But what if part of their bargaining chip was to say we need to see more commitment by the healthcare system to sustainable and environmentally sustainable practice. And right now, what nurses really have is the power of, the staffing. Healthcare systems are struggling to get nurses employed and kept employed. So if we can organize nurses around recruitment and retention to get healthcare systems to have to commit to environmental sustainability, or else to really publicize it, to create a rating scale. What if nurses if we got together and gave these different health systems a letter grade? They're so worried about their letter grade of quality to compete with each other. What if we start getting those sustainability letter grades and publicize that and say, do you really want to work for a C- hospital when you could work across town in an A- or an A+ hospital? Really use that organizational power. So if we can get nurses to sign up just to lend their voice to this, that would be great.
One of the things we're actually working on is a survey. We're hoping to launch it sometime in the fall. And one of the questions on the survey is, does recruitment and retention, I mean, it's worded better than this, impact your decision to stay or work for a healthcare system? So we're trying to get some data that we can then use to go in and start arguing these things. I will let you know that Emily, thank you, has posted the links to the various sites that were referenced. So they're in the chat if you haven't noticed them already. And then there's a question from Caitlin Lissette. She would love any insights you may have into any nursing simulation centers that are working on sustainability efforts. They're currently working on developing one at UNH here for their nursing.
What a great question. I don't know that off the top of my head, though now I'm like, I want to know. And if you find out, tell me. Say more about what you're working on.
So at UNH, we have a very large simulation center, and there's a great opportunity to bring in equipment or medical supplies that say are expired from surrounding facilities. And we can use them in our simulation, as well as sometimes we end up with equipment in our simulation center where people donate or we ordered too much and then it doesn't fit with our system, what have you. And they were throwing it out just right into the dumpster. So I kind of came in and I partnered us up with Partners for World Health. Are you already familiar with them? Okay. So they're actually based in Portland, Maine, and they essentially try to distribute medical equipment and supplies both domestically and internationally. So like I just started doing it. We've redirected like 159 pounds of stuff, but like I want to see this really turn into a good pilot model that could then be applied to all nursing simulation centers across the state. And I would try to market it both as sustainability and financial incentive. So I was hoping there's another program out there who's kind of done some of this, so I'm not reinventing the entire wheel.
Well, that's a fantastic project. And I think, so I don't know, so widespread, I don't know of a resource. It doesn't mean that there isn't one. I wonder if an organization like Practice Green Health, or even Annie that Joan mentioned at the beginning, the Alliance of Nurses for Healthy Environments, they're always pretty tapped into sustainability efforts that are going on across nursing. So I would check out those places to see if someone has pushed this work forward before. But if they haven't, there's a huge demand for what you're working on. So that would be incredible work, and love that you're thinking about like marketing it as a financial gain as well.
Well, thank you.
Caitlin,
I would what?
Reach out to Carlene and have her post the question on CSNA essentials. That will get to all nursing organizations affiliated with the American Nurses Association. And a lot of them are educators or know the educators, and they can pull their states. So we can find that out.
That'd be awesome. Thank you. Because I think ultimately I kind of want this to be like a DNP project. So we'll see.
Yeah.
I appreciate your reaction, Kasey.
Yeah, that's a DNP. I mean, it's bigger than a DNP project, but it would be an incredible DNP project. And I'm definitely going to like stay tuned. I'm going to watch your name and stay tuned and share your work, because that's definitely needed.
Thank you for your work and being here tonight.
Oh, thank you.
Kasey, Caitlin is a fellow with A&E AHE too.
Oh, fantastic.
Yeah.
Just ended, yeah.
Oh, fantastic. I hear that it's a wonderful fellowship. I always hear really good things about it. That's awesome.
We've got about 5 more minutes. Are there any last questions before we end for this evening? And as I said, if you quickly glance at the chat, all of the different links that we've talked about, plus Kasey's climate action guide for nurses, there's links there. She posted it, and one of the other attendees posted it earlier, found it. So all of that information is there. And Kasey just posted her contact information. Thank you, Kasey. We're so excited to have had you. This has been a fabulous presentation, and I know that we here at New Hampshire Healthcare Workers for Climate Action can certainly put this information to use with our nursing cohort. We're an interdisciplinary group, so and hopefully further some of our healthcare sustainability work, because we haven't had the luck that you guys had in Massachusetts. So we don't have, so far, no organization has signed the pledge. We do have Dartmouth working on a lot of the elements of it, but none of them have signed the pledge, which is so sad. And we hear about 50% of Massachusetts health systems have done so. So it's a little daunting for us at this point.
Yeah, you'll get there. The pressure and momentum is there. So the domino's going to fall.
So you're going to do COP this next year at Dubai?
If someone will let me go, then I'll go. Paul, I would totally appreciate your comments about, is that the right place? And I agree that it is a very imperfect, complex process. And then I think we really have to tap in everywhere. Like, we can't say no to any sphere of influence to try to move things forward. So, but yeah, it's an imperfect process for sure. And thank you all so much. I really appreciate the opportunity to be here. It's a pleasure spending time with you.
Thank you. Thank you, everybody, for coming.